but my name is Madeline Reed-Jones, and I am a research economist at the USDA Economic Research Service, and I'm on the food security team. So today I was tasked with talking about how do we measure food security at the USDA, and then I'll talk a little bit about the food security survey, and then since this is new methods in food security, I'll talk about some kind of ongoing food security measurement work and wrap up today. So food security is defined as access at all times to enough food for an active and healthy life for all household members. Food insecurity then is being unable at some time during the year to provide adequate food to one or more household members because of a lack of resources. We also measure very low food security, in which normal eating patterns of some household members was disrupted at times during the year, and their food intake was reduced because they could not afford enough food. So food insecurity is conceptualized as a household level economic and social condition. On the other hand, hunger is an individual level sociological condition that is not measured directly in the food security survey. We do, however, measure again very low food security, which describes that severe range of food insecurity, a condition which may lead to hunger. So how is food security measured? Food security is conceptualized as a continuum. Additionally, we know from prior research that food insecurity at the household level is a managed process, meaning that households do have some control over how they experience food insecurity. So what does that mean? As food insecurity begins to deteriorate within a household, households may begin to worry that their money will run out before they can buy more food. They may begin to stretch their food budget or juggle food with other household needs. Going on to low food security, that's when households may begin to reduce the quality and variety of their diet. And then in very low food security, they may reduce the food intake of first adults, and then in very severe cases, reduce the food intake of children. So here are just some examples of the food security questions that we asked households. We were worried whether our food would run out before we got money to buy more. Was that often, sometimes, or never true for you in the last 12 months? So we asked about the prior year. We couldn't afford to eat balanced meals. Was that often, sometimes, or never true for you? And then in the more severe range of questions, in the last 12 months, did you ever cut the size of your meals or skip meals because there wasn't enough money for food? And then in the last 12 months, in the really severe cases, did you ever not eat for a whole day because there wasn't enough money for food? So how do we collect these questions? Every year, so an annual food security survey is conducted in collaboration with the Current Population Survey, or the CPS. So the CPS itself is conducted by the U.S. Census Bureau, and we have a sample size of around 40,000 households. It is also representative of the U.S. civilian population and is the regular source of employment and poverty statistics, and is just a really high-quality survey in terms of sampling, field staff, and data management. Now, every year in December, we at the USDA ERS sponsor the food security supplement to the CPS, and it's been conducted annually in December since 2001, and it's been fielded in other months in years prior. So here are just some highlights, some key findings from the latest data that's published, and that's from 2023. So we found that in 2023, food insecurity increased compared to 2020 to 2022 for most U.S. households. So food insecurity affected 13.5% of U.S. households, an increase from 12.8% in 2022. Again, we also measure very low food security and found that 5.1% of households experience very low food security. That was statistically similar and not statistically different from the 5.1% in 2022. We also found that children were food insecure at times in 8.9% of US households, which was statistically similar to the 8.8% in 2022. So as I mentioned, we have data going back to 2001, and so that allows us to look at trends in food insecurity and very low food security. So in the most recent years, you can see that increase from 12.8 to 13.5% from 2022 to 2023. And that was an increase again from 2021, which was at 10.2%. Going back in time, we can see there also was an increase in food insecurity from 2007 to 2008 with the onset of the Great Recession from 11.1% to 14.6% in 2008, with a peak at food insecurity at around 14.9% in 2011. We can see pretty similar trends in very low food security, although from 2022 to 2023, around 5.1% were very low food insecure, an increase from 3.8% in 2021. And going back, we did see an increase in 2008 to 5.7% of very low food security. Something that this methodology also allows us to do is look at state-level food insecurity. However, in some states, the sample size is very small, so we have to combine 3 years of data to achieve sufficient sample sizes. So these results show state-level food insecurity from 2021 to 2023. The states in dark orange show states with food insecurity above the US average. In the regular orange color, food insecurity near the US average, which was 12.2% over that time period. And then food security below the US average shown in that lighter yellow. We found that prevalence rates ranged from 7.4% to 18.9% across states. And we also found significant increases comparing to the prior 3 years in 10 states. We did not shown here, but if you're interested in more food security statistics, you can find our annual report on our website. Now, one of the questions that we get a lot after kind of talking about state-level food security data is, do you have data at a lower geographic level? And so today I'll be talking about a new method to predict food security at a lower geographic level and for smaller population groups. And so again, the goal of this project was to develop a method to provide descriptive statistics about predicted food security that goes beyond what has been possible to do with the CPS food security supplement alone. So we use a method called combined sample multiple imputation to impute food security status to a much larger survey than the CPS, and that's the American Community Survey. So briefly, this method involves imputation from a smaller donor data set, which is the CPS, to impute larger values to the recipient data set. What this allows us to do is estimate a predictive model using independent variables that are available in both data sets. And then we use that model to impute multiple estimates of the variable of interest, in this case, household level food security status. So for the food security model that we use to predict food security is based on many household characteristics available in both data sets. So we use income to poverty ratio, education, home ownership, household composition, as well as employment, disability status, and state and year indicators. So what does this produce? We're able to look at state level, within state, predicted risk for food insecurity. So right now, we have one state, and that's the state of Wisconsin, and a little bit older data. But what this allows us to look at and see is that even within one state, predicted risk for food insecurity varies substantially, from around 4% to over 23%. Now, the geographic level that we have in the ACS is called a PUMA, or a public use microdata area. And so what that is an area of at least 100,000 people And so one trade-off of this methodology is that in less populated areas, so in Wisconsin, that's in the more northern areas of the state, multiple counties do have to be combined in order to get 100,000 people. However, one of the strengths is that even in more densely populated urban areas, in Wisconsin, that's Milwaukee County, we're able to look at sub-county level estimates. And so this figure shows Milwaukee County in Wisconsin, and this is, again, predicted risk for food insecurity. And we found that even within a county, predicted food insecurity varied from 7% to the highest in the state at over 23%. Now I'll turn to even some new research on food security and health, as that's today's workshop is about. So today, recently, researchers at ERS updated estimates for the fraction of working age adults with chronic disease in households with income at or below 200% of the poverty line, based on data from 2019 to 2022. What we found is that adults in U.S. households that are less food secure are significantly more likely to have one or more chronic disease, and that likelihood increases as food insecurity worsens. So here's just a quick overview of some of the results. Again, this is predicted disease prevalence for adults in low-income households. And we look at hypertension, arthritis, diabetes, asthma, and COPD. And these predicted prevalence are adjusted for many characteristics, again, including age, income, marital status, race and ethnicity, as well as insurance status. And even after controlling for many of those characteristics, we found that predicted illness prevalences among the 5 chronic conditions were 3.6 to 9.5 percentage points higher for adults in very low food secure. So shown in the chart in that darker color, compared to those who are in households with high food secure. And so I know we'll probably be talking about and hearing a lot about this today, but what these results show is that food security status and health are closely linked. If you're interested in learning more about food security methodology at USDA, you can follow us on social media or go on our website to look at the annual reports. Thank you.